Welcome to this Managing Malnutrition in Care Homes training for care staff, created by the NHS Kerno Clinical Commissioning Group Care Home Support Dietitians. This training is for care staff who do not carry out the Malnutrition Universal Screening Tool, otherwise known as MUST, or who are not involved in nutritional care planning. If you are involved with MUST or nutritional care planning, please complete the full training that includes these areas. This training is being delivered in many care homes across Cornwall and provides an overview of what malnutrition is and how it is identified and managed. This training is also accompanied by our care home resource pack, Managing Malnutrition in Care Homes, which hopefully you will have had a chance to look at. Today we will be talking about a food-first approach for residents at risk of malnutrition. This may not be appropriate for some residents who have complex nutritional needs, such as severe renal disease or complex gastrointestinal disease. If there are concerns about malnutrition with these residents, please refer any concerns to the dietitian they are under. If you're not being seen by a dietitian, the home may need to request a dietetic referral. The care home support dietitians aim to ensure that care homes are confident in managing malnutrition. Alongside this training, we are undertaking ongoing audits of how malnutrition is managed in your care home. We'd also like to know how useful you find the training, so please complete the SurveyMonkey after completing the training. Your manager can provide you with the link.
So why do we focus on malnutrition? Well, there are lots of best practice guidelines that focus on nutrition in care homes and the importance of it. As you'll be aware, the Care Quality Commission are the regulatory body for care homes, and one of the Care Quality Commission's fundamental standards is food and drink. It states that residents must have enough to eat and drink to be kept in good health. There's also Regulation 14 from the Health and Social Care Act, which describes how care homes must ensure residents have adequate nutrition and hydration to sustain life and good health and reduce the risks of malnutrition and dehydration. It also states that residents must also receive the support that they need. There's also the NICE quality standard for nutrition support in adults, and this requires that all care services take responsibility for the identification of people at risk of malnutrition and provide nutrition support for everyone who needs it. These documents highlight the emphasis that is put on nutrition and the requirement that homes have to provide good nutritional care. Ultimately, you are responsible for the nutritional well-being of your residents. So today we will cover what malnutrition is, how to identify malnutrition risk, and treating malnutrition using a food-first approach. So what is malnutrition? Malnutrition very simply means poor nutrition and can refer to both under or over nutrition. We will discuss just undernutrition in this training. Malnutrition can occur when there is a deficiency of energy, protein or other nutrients which can cause adverse effects. By energy, we mean the calories we get from our food and drink. Protein we get mainly from meat, fish, dairy, beans and pulses, and other nutrients means mainly vitamins and minerals. Nationally, we know that approximately 35% of care home residents, when admitted to a care home, are likely to be at risk of malnutrition. Take a moment to think how many people this may affect within your home. It's important to recognise that malnutrition is generally a treatable condition and that by identifying and treating it early, we can help prevent long-term complications.
So why does malnutrition occur? Identifying why malnutrition occurs is the first step in guiding what action needs to be taken. The most obvious cause of malnutrition is poor intake. This may be due to a number of reasons: loss of appetite, illness, medication side effects such as taste changes or nausea, poor swallowing ability or poor coordination. Neglect or poor social circumstances are also commonly seen prior to care home admission. Also, both dementia and poor mental health may impair someone's ability to eat adequately. Malnutrition can also be caused by poor absorption, which can occur as a result of certain medical conditions. The need for increased nutrition in conditions such as COPD, during infection or when there is a pressure ulcer can also cause malnutrition because the body may need more energy and protein to function and to promote healing. All three of the issues outlined here can quickly lead to unplanned weight loss and malnutrition. So we know that the consequences of malnutrition can have a big impact on quality of life. Every part of the body needs nutrients to survive and thrive, so having insufficient nutrition therefore affects every system in the body. It can cause increased infection risk, longer recovery time, pressure ulcers, reduced strength and increased risk of falls, low mood, increased care needs, and increased cost to health and social care. Overall, these consequences can lead to more days in bed and increased care needs, so potentially more GP visits or hospital admissions.
So how do we identify malnutrition risk? In care homes, it is recommended that the Malnutrition Universal Screening Tool, or MUST, is used to screen for malnutrition. Although you may not be involved in completing the tool, it is useful to have an awareness of how it is completed and what the results mean, so we will cover this briefly now. Screening should be undertaken on admission and monthly thereafter for every resident where possible, not just those who are visually underweight or have lost weight. The full tool can be found online, but there's also a version within our resource pack. If you use electronic records within your home, there may be an automatic MUST calculator within it. The MUST tool is a step-by-step process which involves scoring somebody's body mass index, any recent unplanned weight loss which has occurred during the last 3 to 6 months, and the presence of acute illness or lack of nutritional intake. However, this third point is unlikely to be relevant for care home residents. The scores are then added together to give an overall risk of malnutrition score. The overall score will be either 0, meaning low risk of malnutrition, 1, meaning medium risk of malnutrition, or 2 or more, meaning high risk of malnutrition. Once the score is obtained, staff should then follow the appropriate actions on the malnutrition care pathway, which is within the resource pack.
You might not be involved in calculating a resident's MUST score, but may be asked to measure height and weight of residents. The following information will help you obtain these measurements as accurately as possible and give you an understanding of why this is so important. Let's consider weight first. If a resident's weight changes significantly from month to month or week to week, you should question the accuracy and reweigh when possible. Be aware of whether they are holding on to something when being weighed, such as a wall or the bed, or perhaps the scales are faulty or have recently been recalibrated. If weights appear unusually high, perhaps different clothing or footwear are being worn, there are heavy items in pockets, or they have a catheter bag attached. Please be aware fluid retention can affect weight, so please discuss with a senior member of staff if your resident is retaining fluid. If you cannot obtain a weight for a resident, you may be asked to take a different measurement called mid-upper arm circumference, or MUAC, which could be used to estimate BMI or be used to monitor the resident over time if you are unable to weigh them. Instructions on how to measure MUAC can be found in the resource pack. They are also within the MUST tool, but we will go through it briefly here. Start by getting your resident to bend their left arm at a 90-degree angle and hold it against their body. Then measure between the bony protrusion on their shoulder and the point of their elbow. Find the midway point of this measurement. So, for example, if the measurement is 30 centimetres, the midway point will be at 15 centimetres. Next, let the arm hang loose by their side. You then need to measure around the upper arm at the midpoint you have just identified. The tape measure should be snug but not tight. Make sure you take the measurement in centimetres, not inches, then record it in the care plan. It would be good if you could practice this on a colleague to ensure you feel confident.
We're now going to think about measuring height. Sometimes it might be difficult to measure a resident's height, perhaps they're bedbound or have a spinal curvature. In this case, you may be asked to take an ulnar measurement instead. This can be used to help estimate height. We will now quickly explain how to take an ulnar measurement. First, you need to position the resident's left arm up against their chest with their hand on the opposite shoulder. Measure between the point of the elbow and the midpoint of the prominent bone of the wrist. Measure in centimetres and record this in the resident's care plan.
Once a resident's risk of malnutrition has been assessed, we recommend using this malnutrition care pathway for care home residents as your local policy, as it suggests pathways for care planning specifically in care homes and has been created in line with best practice guidelines. The malnutrition care pathway may not be something that is seen by care staff, however, it is useful to have an awareness of its process so that you can see where your role links in with it. The pathway describes how to manage malnutrition risk based on MUST score and using a food-first approach. Here is the pathway for a MUST score of 0, so low risk of malnutrition. Residents should be reviewed monthly. However, if they have a pressure ulcer or poor wound healing and there are concerns about their intake, we would recommend following the MUST 1 more pathway with an emphasis on high protein options. Residents with a MUST score of 1 or more are at a medium or high risk of malnutrition, and the MUST 1 or more pathway should be followed. The pathway guides staff through completing a nutritional care plan for the resident, which will include a food-first approach. The pathway is linked to various checklists, templates and supporting information, some of which you may be asked to complete. For example, you may be asked to complete a mealtime observation checklist, or you may be asked to record a resident's food and fluid intake. Take care to include as much detail as possible, such as portion size eaten.
We will now go on to discuss treating malnutrition using a food-first approach. Food first is the first-line treatment for those at risk of malnutrition and includes principles such as eating little and often, food fortification and providing nourishing drinks. Residents with smaller appetites can often be overfaced by large meals, so offering smaller meals alongside regular nourishing snacks and drinks is likely to result in a higher nutritional intake. Fortifying meals means increasing the nutritional content without adding volume, by adding regular food items such as cream, cheese or butter. In terms of drinks, lower calorie or low sugar drinks should be minimised, and higher calorie drinks or homemade fortified drinks should be encouraged. Nourishing drinks can include coffee made with milk, hot chocolate, malted drinks, plain or flavoured milk and fruit juice. Food-first treatment can be implemented without the need for a dietitian and can often reduce the malnutrition risk without a dietitian or a GP needing to be involved.
Our resource pack recommends a 1-2-3 approach to food first. 1 refers to providing 1 pint of fortified milk per day. Fortified milk is made by adding 4 heaped tablespoons of skim milk powder to normal full fat or blue top milk. The full recipe and ideas on how to use it can be found in the resource pack, but put simply, it can be used in place of normal milk throughout the day. Using fortified milk can be a very simple and effective way of boosting nutritional intake without adding extra volume. It is a very good source of protein, which supports with improved strength and healing. It can also really help with achieving weight gain or weight maintenance. We found that since delivering the training throughout Cornwall, care homes have found fortified milk one of the easiest things to start using with their residents. Make sure you have access to supplies of skim milk powder in your kitchen. At breakfast, you could use fortified milk in cereal, porridge and in egg dishes. For meals, it can be used in soups, sauces, Yorkshire puddings, mashed potato and egg dishes. You can also use it in all milk puddings and hot drinks. Remember to take a jug of fortified milk with you on the drinks trolley.
Step 2 of the 1-2-3 approach refers to offering a minimum of 2 nourishing snacks per day, but preferably 3. You should try to offer a wide variety of different snacks, both sweet and savoury, each day to keep residents interested in snacking. Make sure snacks and drinks are placed in reach of residents and you provide regular prompting and encouragement where needed. Remember to consider whether a resident needs adapted cutlery or crockery. If giving biscuits, try and opt for higher calorie ones, or try spreading plainer biscuits with something like butter or chocolate spread or peanut butter. You could try serving fruit with custard or cream. There are plenty of everyday snack ideas within the resource pack, including savoury options such as cheese and crackers, mini pork pies and peanut butter on toast. Snacks should be offered little and often away from meal times so that they don't affect the resident's appetite at the next meal. Ideally, they should be offered mid-morning, mid-afternoon and before bed. Bedtime in particular can be a great time for snacks, as eating at this time won't ruin appetite for a forthcoming meal. Discuss with your resident if they have any preferences about what they might like for their supper before bedtime. We recommend that at least one of these snacks is a high-calorie fortified snack. Our top recommended one is a fortified yoghurt, which is a normal thick and creamy yoghurt with a heaped tablespoon of skimmed milk powder and 1 tablespoon of double cream added. This almost doubles its protein and energy content. This can be used as part of breakfast or with a pudding after meals or even just as a snack on its own. It's very quick and simple to prepare and can even be done within the yoghurt pot. Within the resource pack are recipes for a fortified lemon cream and a fortified chocolate caramel cream, which the chef might make up. These are high in calories but lower in protein, so we would recommend that these are only offered once a day. Make sure you have a system to record when these are given and how much is taken.
The third part of the approach is 3 two-course fortified meals. We've mentioned that fortifying food means adding certain ordinary food items that are high in calories and protein to other foods to increase the nutritional content without increasing the volume. Try to fortify the whole meal rather than just one part of it. This might mean, for example, adding some cheese and fortified milk to mashed potato, some butter or margarine to vegetables, and some cream to the pudding. Make sure you communicate with catering so you know which meals have been fortified and whether you need to be adding any additional items before serving. It is important to remember to regularly fortify with foods containing protein and not just foods that will only add extra fat and calories, such as butter and cream. Higher protein foods to fortify with may include skim milk powder, cheddar cheese, nut butter, chopped or ground nuts, and thick and creamy yoghurt.
You may have residents in your home who require texture-modified diets. Food and drinks have been classified by the International Dysphagia Diet Standardization Initiative, or IDSI, according to their texture, and the diagram on screen represents the different levels of food and fluid that may be recommended for your residents. The consumer handouts under the resources section on the IDSI website give lots of ideas for foods of every texture. Make sure you know which IDSI level your residents need for food and drinks and ensure whatever food and drinks you give are appropriate to that individual. Remember, if you are fortifying meals, snacks or drinks, that this can change the end consistency. Care home staff must always follow the IDSI guidance for testing textures to ensure that all food and drink is a suitable consistency for their residents. Guidance on testing textures of food and drinks can be found on the IDSI website.
For some residents, the use of homemade fortified drinks may be needed in addition to the 1-2-3 approach. Recipes for these are provided in the resource pack, and the most nutritionally complete ones with the most calories and protein are a fortified milkshake and a fortified hot chocolate. These may be made by your chef or could be made by care staff in some homes. Both are made with fortified milk and double cream and use a milkshake or hot chocolate powder that is fortified with vitamins and minerals, which is really important. The recipes have been formulated to be nutritionally similar to prescribed supplements and are concentrated in both energy, protein, and vitamins and minerals. It is important to follow the recipes without adding to the recipe or changing it, as this can reduce the energy and protein concentration of the drink. For those residents who are not able to have milky drinks, we have included a fortified fruit juice. We also have recipes for fortified soups and have recently added a dairy-free recipe to our resources. We also have a recipe for cream shots, which are only 40 ml each and offer a good boost of calories, although are lower in protein. We recommend giving 1 to 2 of the homemade fortified drinks per day where residents have a must score of 2 or more, or if weight loss or poor intake continue despite the other dietary changes being tried. Most of the recipes make a drink about 200 to 250 ml in volume. If residents find this too much, the drinks can be split into smaller shot-style portions, which might be more manageable. If you have a few residents who are being offered these drinks, the recipes can be made up in bulk at the start of the day and kept in a jug in the fridge, ready for drinks rounds or when the resident may want it. A couple of flavours could even be made each day to give more choice to the residents. We always encourage homes to try offering homemade fortified drinks first rather than requesting prescribed supplements, as prescribed supplements may not be necessary much of the time.
Next, we're going to take a look at a hypothetical day's intake for a resident who has a small appetite and may be at risk of malnutrition. We will then think about how we might improve their intake using the 1-2-3 approach. So the meals for the day: breakfast is a medium bowl of porridge made with milk, lunch is a small portion of cottage pie with mixed vegetables, and the evening meal is half a ham sandwich with some tinned peaches. Each of these meals provides less than 300 calories and less than 15 grams of protein each. So moving on to snacks. They're having a biscuit mid-morning and another in the evening. For drinks, they're having 4 cups of tea and a cup of coffee. And we can see that this person's snacks are quite minimal, and although the drinks provide a reasonable amount of fluid, they don't provide much in terms of calories or protein, even though they've been made with whole milk. So the total for this person's intake is less than 1,000 calories and only about 36 grams of protein. This is unlikely to be enough to sustain an adult's weight, so it's not surprising that this resident is losing weight and is at risk of malnutrition.
So let's think of how we might use the 1-2-3 approach to boost the nutritional content of this person's diet in order to manage their malnutrition risk. If we use some of the fortified milk in the porridge and added 10 grams of ground almonds, for example, this would add over 100 calories and 8.5 grams of protein and wouldn't make the porridge any sweeter or increase the volume. You could of course add things like sugar, jam and syrups if they were tolerated to add even more calories. If they could manage it, you could encourage a second course, such as toast with butter and jam. Next is lunch. By adding 30 grams of cheese and 10 grams of butter to the cottage pie and vegetables, we add about 200 calories and almost 8 grams of protein without making the portion any bigger. You could of course encourage a pudding as well if tolerated. For the evening meal then, if we added half a tablespoon of mayonnaise to the ham sandwich and a tablespoon of cream to the tinned peaches, that would add another 147 calories and 4 grams of protein. With the snacks, we could swap the morning biscuit to half a scone with butter and jam, and swap the evening biscuit for a fortified yoghurt. This gives an additional 358 calories and 10 grams of protein, adding a really good amount to the overall total. Alternatively, you could change to high-calorie biscuits if preferred, or spread plain biscuits with butter, Nutella, nut butter, or add cheese. You could encourage a third snack if there was an appropriate time in the day for this. Finally, the drinks. Using fortified milk in the cups of tea and using it to make a milky coffee would significantly increase the calories and protein from those drinks. This adds almost 200 calories and 14 grams extra protein without increasing the volume. This example day shows how simple and effective it can be using the 1-2-3 approach before considering adding additional courses or nourishing and homemade fortified drinks. We can see that the total calorie and protein intake for this day has almost doubled without adding any significant extra volume. It is important to remember that there are lots of different ways to fortify a resident's diet, and where possible, it is important to ask the resident what they prefer their food to be fortified with. Drinks can also be really useful for increasing calories and protein intake, especially when someone is eating very poorly.
So now we have discussed what dietary changes can be made, it is important to make sure that changes are clearly documented and communicated to the right people. It's important to regularly communicate with your residents where possible about their likes and dislikes and how they are finding the dietary changes that have been made. If they do not like all of the changes made, it is important to find alternatives that are more acceptable to them and communicate this to catering and the wider team. Regular communication with other care home staff is important so that you are aware of the nutritional needs of each of your residents. Make sure you have access to all the relevant information from the residents' nutritional care plans, such as any special dietary requirements and any food-first approaches needed. Communication of this information could be via verbal handover or a whiteboard or a folder in the kitchen. Ensure you know which system is used in your care home. Many residents may require additional snacks or nourishing drinks once catering staff have left for the day. Ensure you know how to access them and which residents they are for. Care staff will be regularly reviewing resident care plans and assessing how they are progressing towards their nutritional aim. Once the nutritional aim has been met, so for example they have reached their target weight and their appetite has returned to normal, any changes should be gradually reduced whilst weight continues to be closely monitored. So for example, you might reduce fortification and higher calorie snacks and encourage a balanced diet that helps the resident maintain their improved nutritional status. Ensure that you communicate with senior care staff regularly so you know what you need to be providing.
So that brings us to the end of the training. We really hope you've gained a lot of knowledge and confidence in managing malnutrition in your care home. Please complete the Survey Monkey. Your manager can give you the details. Please do contact us if you need extra support or would like us to provide any further training in the future. Thanks for watching.